Hi guys, this is Ms. Ramani, and this week we're going to be learning about vital signs. So what are vital signs? Well, vital signs are basically measurements of our body's most basic functions. And there are four measurements that are taken both by healthcare providers, doctors, nurses, sometimes emergency personnel, and sometimes even at home. And these are your temperature, your pulse rate, your respiration rate, and your blood pressure. So these four are our vital signs. And together, they can be useful in detecting and monitoring medical problems. They're not on their own a diagnostic tool, but they can certainly aid in giving healthcare providers or EMTs or even parents a picture of the overall health of the patient or just indications of different problems that may be arising. They are measured always in a medical setting. They can also be measured at home or they can be measured at the site of a medical emergency. If you've ever gone to an emergency room, you know that the first thing that you are asked to do after you go to reception is present yourself to a nurse who will take your vital signs. And then that way they can determine the order in which patients will be seen based on partly the reason they're presenting themselves to the hospital, but also what the vital signs tell them about the degree of the emergency for that particular patient. So let's start with body temperature. Body temperature has a normal range, which might vary for individuals and might actually vary for one individual for a variety of reasons. So, for example, one of the reasons that we have differences in body average normal body temperature could be just age. Younger people tend to have warmer body temperatures, a little bit higher body temperatures than older people. Another thing is gender. On average, women tend to run a little bit colder than men. They tend to have a slightly lower body temperature than men, and it's a variety of factors. One of them could be muscle mass and metabolic rate, but in there are slightly differences in average body temperature between women and men. Recent activity, obviously, exercise can have an effect on your body temperature. Um, Fluid consumption, the type of food that you're eating. If you eat really hot, spicy food, you're going to have an elevated body temperature as a result of that. The time of day. Our body temperature actually varies tremendously between morning and night. It can vary as much as an entire 1 degree to 2 degrees Celsius for certain individuals between morning and nighttime. And so our body temperature is highest in the middle of the night and lowest first thing in the morning, and then it kind of cycles throughout the day. For a woman, body temperature will vary depending on where she is within the month as far as her menstrual cycle is concerned, because women's body temperature dip the day before ovulation and then spike, oftentimes even up to 38 degrees Celsius or higher, the day of ovulation, and then dip again right after. So a lot of women actually can track their ovulation cycles if they're trying to get pregnant or even, I guess, avoiding pregnancy, but it doesn't really work that great for avoiding pregnancy, but it would definitely work by helping someone try to get pregnant by tracking their body temperature and determining when they're ovulating that way. And like I said before, body temperature is actually different as we age. So normal body temperature is highest for infants and much, much lower for elderly people. As we get older, we get colder. Our body temperature drops a little bit, or our average body temperature drops as we age. So normal body temperature then is a range. It can range between 36.5 degrees Celsius, which is 97.8 degrees Fahrenheit, to about 37.2 degrees Celsius, which is about 99 degrees Fahrenheit. That's what we consider to be the normal range. And that might vary slightly for some individuals. Some individuals may run a little bit colder than that or a little bit warmer than that, but that's the average body temperature range. Now, in order to measure our body temperature, we use what is called a thermometer, but there's not just one type of thermometer. There's a variety, and you might have one of these or maybe a couple of different types at home. The glass mercury thermometers are no longer available. Those are the ones that we had when I was young. They obviously contained mercury, and are no longer being sold because whenever the glass would break, the mercury would escape and that's toxic. It can cause brain damage. Um, Now, glass thermometers are usually made not with mercury but with alcohol, but I don't think a lot of people have those at home, and they're not necessarily used in hospital settings much anymore. So there's the digital thermometers, which basically, um, you know, do not use mercury or glass or alcohol to measure temperature, but they're digital. And most of the other ones that we see here are all digital. There are some that use infrared. There's a tympanic or ear thermometer that uses infrared, but is inserted inside the ear. And there's then now also an infrared thermometer that uses um, that is just aimed at the forehead and is a no touch thermometer, so you don't have to touch the body, and you can get an instant reading. There's a variety of other things like patches that you can put on a child's forehead and it'll change temperature, but those are not very reliable. So those are the four main types of thermometers that you might see. So how we take temperature varies. So if, say, for example, you're using a glass thermometer or a digital thermometer, there's a few places where you can take temperature. So one of the places that is commonly used is oral temperature, which is basically inserting the thermometer. You don't put it in your mouth, it goes under your tongue. So you have to be able to hold the thermometer under your tongue for whatever amount of time is necessary for the thermometer to reach the temperature that, or detect the body temperature that it can find in your body. Rectally is another very common form of taking body temperature for babies, because babies cannot easily hold a thermometer under their tongue. If you tell a baby, hold this under your tongue, they're not going to do it. So a rectal thermometer, rectally is another way of taking body temperature. Rectally tends to be slightly warmer than when taken orally, so you have to keep that into account. So whatever temperature you get from someone orally, you're going to get about 0.5 degrees higher for that same patient if the temperature is taken rectally. And also, this method is the most accurate out of all the methods. Axillary, which is under the arm, is another method that is used for babies. This is in case you have an oral thermometer that you use for people's mouths, but you obviously are not going to be inserting it rectally, and you have a baby and you need to take their temperature, and babies are not going to hold that thermometer under their tongue, so you can actually take it axillary under their armpit. Keep in mind, when taken axillary, temperature tends to be lower than when taken orally, by about half a degree Celsius. So you just have to keep that in mind. You're going to get a lower temperature than what the baby's actual temperature would be. And this is actually the least accurate method. Nowadays, one of the most common ways of taking body temperature is just actually using a tympanic thermometer and inserting it in the ear and just getting an immediate automatic reading of body temperature using infrared technology. Most hospitals will use a tympanic thermometer to take patients' temperature because it is an immediate. You don't have to wait for the thermometer to kind of give you a reading. So what happens when then your body temperature is outside of that normal range? And so this is when you can get into temperatures that are too high or temperatures that are too low. When your temperature is too high, we get into something called hyperthermia. Now, you don't usually hear the term hyperthermia, but you probably would have heard the term fever or the term heat stroke. Both of them can cause hyperthermia. A fever is usually the body temperature elevating, oftentimes as a result of the body fighting an infectious disease, and heat stroke is the body temperature increasing, oftentimes in response to elevated ambient temperature. So being outside on a really hot day or exercising to the point of getting too hot. So usually a fever is indicated when the body temperature rises above 38 degrees Celsius when measured rectally. Heat stroke is what happens when your body temperature raises above 40 degrees Celsius. Keep in mind the cost, right? The cost, your fever can also get above 40 degrees Celsius, but heat stroke has a different cost. Both of these can be dangerous. The risk of brain damage and death starts when body temperature gets above 42 degrees Celsius. So, both fever, which is called pyrexia, and hyperthermia, that can that can be a result of heat stroke, and both of them can have significant risk of brain damage and death, especially when temperature gets above 42 degrees Celsius. On the opposite end of the spectrum, we have hypothermia. And hypothermia is what happens when body temperature drops below 35 degrees Celsius. And this is the temperature at which body functions start to be affected. Loss of consciousness will start about 28 degrees Celsius, and death at around 21 degrees Celsius. So, another vital sign that is measured is respiration rate. And as the name indicates, the respiration rate is basically the rate or the speed at which a patient is breathing, the number of breaths a person takes per minute. Now, obviously, watching someone breathe for a minute is going to be very awkward. And, you don't always have to measure someone's breathing rate for an entire minute. Sometimes you can, measure for 30 seconds and then double the amount. But it's basically the value is given as the number of breaths per minute. And the rate is usually measured when a person is at rest, and then simply involves just counting the number of breaths for 1 minute or for 30 seconds and then doubling the number. And that by counting just how many times you see the patient's chest rise. There's a variety of different things that can cause someone's respiration rate to increase. And this is the reason why it's used as a vital sign. Some of these are completely fine and normal and not a sign of distress. Like, for example, with exercise, our breathing rate increases. So if you, went for a jog, went for a run, decided to go all the way up to the 3rd floor at Notre Dame, and you end up breathing really heavy, that's fine. That's normal. That's an elevated respiration rate. But sometimes medical conditions can also increase your respiration rate as well. A fever, sometimes when you have like respiratory issues or infections in the lungs or the bronchi, can lead to higher breathing rate because your body's trying to compensate by not getting enough oxygen. And there's other medical conditions. So, for example, something called ketoacidosis or acidosis, oftentimes found with diabetic patients, increases your respiration rate because one of the ways that our body has of reducing acidity in the blood, which is what acidosis is when your blood becomes too acidic, which can be caused for a variety of different things. But one of the ways that we can reduce the acidity in our blood is by breathing faster. Because when carbon dioxide is dissolved in our blood, carbon dioxide reacts with the water in our blood and becomes carbonic acid, which in turn decreases the pH of our blood, increasing the acidity of our blood. So by breathing heavier, we can get rid of more carbon dioxide gas and therefore lowering the carbonic acid in our blood. And that's a sign of acidosis. And acidosis can be caused by exercise, but it can also be caused by metabolic problems, like conditions that are happening inside the body that is causing too much acidity to be formed. They may also be lower. Breathing rate may decrease also during overdoses, especially for certain drugs like opioid overdoses, when patients enter diabetic comas or other medical conditions. So it's important that you are able to, say, for example, measure someone's breathing rate. If you're at a party and you encounter someone who's passed out, one of the things that you might want to look for them to see if they're in crisis is to check their breathing rate. So respiration rate varies significantly by age. So the normal rate for an adult might be half the rate as it would be for a baby. But normal respiration rate for an adult ranges between 12 to 20 breaths per minute. Babies in general have a faster breathing rate than older children and adults. If you look at this chart, you can see that babies have almost twice as fast, or actually more than twice as fast in some cases as adults. So that's something to also keep in mind when you're looking at respiration rate and you're dealing with a child as opposed to you're dealing with an adult. So next, we're going to take a look at pulse rate. And so pulse rate is essentially the measurement of your heart rate, or the number of times your heart beats per minute. And again, just like with breathing rate, if you're measuring someone's pulse rate or your own, you don't have to actually measure for a full minute. You can also measure for 30 seconds and then double the amount. But the measurement is always given as a beats per minute, or BPM. Your pulse rate, it can be measured without actually having to directly listen to your heartbeat with a stethoscope or putting I don't know, your ear to someone's chest, because as your heart pushes blood through your body and it pushes blood through your arteries actually expand with the flow of blood, and it moves through, your blood moves through your arteries in a pulse wave, which can then actually be felt with your fingertips. So when we measure someone's pulse, you can actually measure not just the heartbeat or the heart rate, the number of beats per minute, but you might also be looking for their heart rhythm. You can check if they have a steady, which is what is expected, a steady heart rate, or you can sometimes check to see if the heart rhythm is irregular, which could be a sign of distress, or sometimes, signs of heart disease, or sometimes just signs of something called a heart murmur, which is a non-life-threatening irregular heart rhythm that some people might have. You can also be looking for the strength of the pulse, if it's strong or weak. This is particularly important if, say, for example, an EMT arrives at the site of an accident and then they're measuring a patient's pulse rate, and they're also trying to determine if they have a weak pulse or a strong pulse, because a weak pulse might be an indication that they're under severe distress. And so it's a good idea to have a range that you can use to sort of figure out whether or not someone's heart rate is elevated or not. But the range can vary significantly by age and a variety of different things. So for example, the average resting heart rate or pulse rate for a healthy adult ranges between 60 to 100 beats per minute. That's when they're at rest. Obviously, when they're exercising, it's going to be higher. But well-trained athletes will have a much lower resting pulse rate. So well-trained athletes can have a normal pulse rate of about 40 to 60 beats per minute. And so there's a couple of things when it comes to pulse rate as well, is the fact that the younger you are, the higher your resting heart rate than as you get older. So as you get older, your resting heart rate is going to slow down. So a baby, a newborn, is going to have a resting heart rate of about 70 to 190 beats per minute, and that's normal. Whereas an adult above 10 years old, really, so even children, will have between 60 to 100 beats per minute. That's not counting athletes who might have a lower resting heart rate. So the pulse rate might actually also fluctuate for an individual for a variety of reasons. Exercise very commonly and completely, obviously, non-life-threatening, but some illnesses, some diseases, injury, emotions can cause an increased heart rate. An anxiety attack, if you receive some bad news, if you get scared, if you're in a roller coaster, those things can actually elevate your heart rate. Exercise will, but certain diseases as well. Respiratory distress can sometimes increase your heart rate because your body's trying to struggle to get oxygen. So if, for example, you have something like pneumonia, that is often associated with a fast heart rate as well, because the body's trying to get oxygen to your cells because you're not getting enough oxygen out of your lungs. So how do we check the pulse rate? In order to check the pulse rate, there's certain pulse points in our body where the pulse rate of the blood moving through the arteries can easily be felt. And so you're going to firmly press on those areas with 2 fingers, and then just count how many beats you feel as you move through. So you can practice on yourself, or you can practice on someone else. And there's a few places that are very commonly used for measuring pulse rate. The carotid artery, which is a carotid measure of pulse, is at the neck. So you just want to go right below your ear and just sort of press down until you sort of feel your blood moving through. You press down with 2 fingers and until you feel sort of the blood moving through. There's the radial measurement, which is at the wrist. There's the brachial, which is at the elbow. Then there is others as well that can be used when those 3 main ones are not available. So for example, you can take someone's pulse rate at their foot or their ankle. This can be done like in the site of an accident, if that's the only part of the body that you can reach or something like that. And last, we have blood pressure. And so blood pressure is basically a measure of the force of blood that is pushing against the artery walls. And blood pressure is measured as 2 numbers. with a device called the sphygmomanometer. And the sphygmomanometer is basically that cuff that it gets inflated, and oftentimes there's digital ones where essentially a digital reading is done. But if you go to a medical setting, oftentimes you'll find that they'll use a stethoscope in order to listen to the heart sounds as the pressure, in the cuff is reduced in order to give you a blood pressure reading. And a blood pressure reading is always going to be two separate numbers. And the two numbers are going to be your systolic and your diastolic pressure. So systolic blood pressure is the highest number that you get. And the highest number refers to the pressure inside your artery when the heart is contracting and pumps full of blood and the arteries are expanding. And so this is the blood pressure that is high, the arteries are expanding, and normal systolic pressure on average is about 120 millimeters of mercury. Diastolic pressure is the second value, and that's the lowest number, and this is the number that is measured when the arteries are under lower pressure as the heart is relaxing and filling with blood. And so normal diastolic pressure is 80 millimeters of mercury, so that gives us normal blood pressure to be usually measured as 120 over 80. That's what we consider to be kind of the average normal adult blood pressure. So here you can see a chart that shows how blood pressure measures might vary as we age. And we saw before how as we age, temperature gets lower, breathing rate gets lower, and pulse rate gets lower. But with blood pressure is the only one that is the opposite. Blood pressure is actually lowest when you're younger, and as we age, that blood pressure gets higher. And so 120 over 80 is an average, but usually that's kind of the average that you will find in your 20s. So hypertension or high blood pressure is what happens when adults will have a blood pressure that is higher than 140 millimeters of mercury systolic and 90 millimeters of mercury or higher diastolic. So 140 over 90 or higher than that. And hypertension is oftentimes a sign of heart disease, and it increases the risk of coronary heart disease, heart attacks, strokes, angina. Oftentimes it is due to poor lifestyle choices, poor diet, lack of exercise, smoking. Those are things that can lead to hypertension. There's other conditions that can lead to hypertension. Metabolic syndrome, and diabetes can lead to hypertension, certain medications, and sometimes it's also just genetic. Some people just tend to have higher blood pressure than others. What can sometimes lead to hypertension when it's heart disease is because plaque develops within our artery walls, then that can reduce the space through which blood can flow, which in turn increases the pressure inside the arteries, makes the arteries less elastic, less able to expand, increases the blood pressure. So finally, we get into hypotension, and that's low blood pressure. And hypotension is basically considered to be low blood pressure that is below 100 millimeters of mercury or lower systolic and 60 millimeters of mercury or lower diastolic. And hypertension can be a result of many things, sometimes medication, sometimes blood loss, sometimes even just dehydration can lead to lower blood pressure. And it can definitely have some effects. It can lower your ability to deliver oxygen and nutrients to your body cells. It can sometimes also cause people to feel faint easily or dizzy. So if they get up really quickly and they feel a little bit dizzy, it could be a sign of hypotension, low blood pressure. So it's something to kind of watch for. It sometimes just might mean that you need to drink more water if that's the case. So that's it for your lesson on vital signs. You will have an opportunity to revisit this topic when you complete a vital signs activity, either in class or at home later on. Talk to you soon.